Hello, this is Chris Pickard at Body in Balance in Hertfordshire, and today I'm going to bring you some amazing tips on how you can help your back pain at home, both acute and chronic pain. And most importantly, I'm going to tell you what you absolutely should not do in the first 2 or 3 days of an injury, any injury. Okay, but I'm going to leave that to the end, and I'm going to tell you where you can get some more free resources to help you, especially with chronic back pain. So first of all, what is chronic back pain? What is acute back pain? Acute back pain is something acute pain is something that's just happened. So you've woken up, you're in pain, or you've just had an injury and you've had pain and it's just started very recently. Chronic pain is basically any pain that's lasted longer than 6 weeks. So some of this is going to be relevant for acute pain, some of it's going to be relevant for chronic pain, some of it's going to be relevant for both. Now, before we continue, make sure you subscribe to the channel to make sure that you get more updates from me, and there should be a sort of a bell notification to hit somewhere so that you actually get notifications when the next video comes out. So what is the first thing you should do? Okay, well, if you've just suddenly injured yourself, one of the best things to do, especially in the back, one of the best things to do is to actually just rest for a moment. Try and find a non-painful position and get an ice pack. Cool it down and ice the area for about 5 to 10 minutes. Wrap the ice pack up in a tea towel, maybe even a slightly damp one. So this is going to make sure that the coolness is conducted, but it's not going to be too fast. And you want to do that for about 5 to 10 minutes. Even if it feels good, more than 10 minutes, and you could cause damage to the area by decreasing the blood flow too much. If you've got chronic pain and the injury was maybe more than 7 days ago, you might want to try just heating it up. So get a hot water bottle, again, wrap it up in a towel, tea towel, put it on the area, and try leaving it on for up to 20 minutes. Okay, so not too hot, just a nice, gentle, soothing warmth. And also, if you've got back pain, surprisingly, you may find actually putting a hot water bottle on the front of your tummy can be very relaxing and soothing, because there are a lot of back muscles at the front of the spine, and this often gets neglected. Now, sometimes in between, so if you've just injured it and it's about 3 days ago and it's not yet 7 days ago, so between 3 and sort of 7 days, you might actually want to try cooling it down for a few minutes, then taking it off, and then heating up for a few minutes, then taking that off, and then cooling it down for a few minutes. Now, the ice and the coolness helps contract a muscle and decrease blood flow, and then the heat actually helps bring in more fresh blood, so it can speed up the healing, and then the ice contracts and gets rid of that blood. So try those things. Try ice at first, then alternating between ice and heat, and then just heat. And usually for chronic pain, heat is usually better. Now, what's the next thing you can do to help yourself? Well, basically, a lot of people with back pain, their back isn't actually arching properly. And so when you're lying down in bed, the flexion position can actually be quite discomfort on the discs. Okay, so you want to keep that curled in. And so we have some great pillows that you can actually put basically underneath your belly button. Okay, so you're lying on your back, this goes approximately opposite your belly button, and this helps stretch the spine, and it helps stretch these structures here a little bit. It helps relax the back. Now, if you haven't got a special pillow, which also they absolutely feel absolutely amazing when you lie on the floor as well, those ones, you can try putting a rolled up towel that I've used some elastic bands, and you can try putting that underneath your back as well, and try relaxing like that. And you can do that for a few minutes. You can do it up to 10, 20 minutes. Some people like even sleeping like that. Okay, so you've got the pillow, spinal molding. Then there are different exercises. Different types of back pain can be relieved by slightly different stretches and exercises. So for that, I'm going to put links to a lot of my exercises. Hopefully somewhere around here, I'll put a link to lots of my exercises, and go and watch those and try them, because say, for instance, disc pain may respond better to certain exercises. Piriformis syndrome, different exercises. sacroiliac joints, different exercises. So just try them gently. The next thing you can do is there are natural herbs that can help bring down pain in your body. Things like turmeric, ginger, boswellia, also known as frankincense. Now, a lot of these you can actually take every single hour, as long as you're not taking some medications or as long as you haven't not getting any stomach effects. But natural things like ginger and turmeric, you can take pretty much every single hour. With turmeric, make sure that it's not come from India, because some Indian companies actually put in lead to make the turmeric look more yellow and more appealing. So make sure it's organic, make sure you know where the turmeric is coming from. But there's lots of other natural herbs and nutrients that you can actually take to help you. So I've got two resources. One is the Natural Pain Relief Report, and I'll put a link in the comments and in the description below the video. I'll put it in the video hopefully somewhere as well. And there's also my 7 days to less pain free course as well, because especially for chronic pain, people can stay in pain because they're not putting enough of the right nutrients in their body that allow you to make new muscles, bones, discs, muscles, all these things. So you can literally be eating in a way to keep yourself in pain. And so I like to teach people how to eat their way out of pain. So please get those two free resources. Now, finally, one more thing, what you should absolutely not do within the first 2 to 3 days of an injury. And this may sound quite bizarre, but it's don't take anti-inflammatory pain-killing drugs. Why not? Well, natural anti-inflammatories like turmeric and ginger actually promote the healing process as well as helping bring down some of the pain. But things like ibuprofen and paracetamol actually block parts of the healing process. They disable the liver, they can cause more inflammation in the gut. And the way they work is actually literally by blocking all parts of the healing process. And people who take anti-inflammatory drugs very early on, like immediately, actually then have an injury for longer because the ligaments and the muscles don't reform very quickly. In fact, they can be weaker. So the first 2 or 3 days of an injury, it's actually a good idea to try and avoid painkillers and anti-inflammatories as much as possible and stick to the natural routes. Try and stick to the things you actually have control of, like ice and heat and gentle movements. And really you should only be taking pain relief for a maximum of 3 days, and only if the inflammation cycle isn't coming down. So you need to give your body a natural chance to heal, because you'll actually decrease your chance of having chronic pain if you don't take the drugs. If you require more help, more personal help, then please reach out to bodyimbalanceuk.com. Our website also is thepainreliefcentres.co.uk, and our phone number is 01 707 662 704. I wish you well. Please let me know how you go with these resources. Be well.